Hello, so welcome to our topic about the ankle foot region. So first let's talk about the structures that passes beneath the extensor retinaculum. So these structures are aligned from medial to lateral. The extensor retinaculum is located anterior to the ankle joint or proximal to the dorsum of the foot. So these are the structures that pass beneath the extensor retinaculum. Next is the dorsal tunnel, a tunnel formed beneath the flexor retinaculum. So the dorsal tunnel can be palpated proximal to the medial malleolus. And these are the structures from medial to lateral that passes behind or beneath the dorsal tunnel. Let's go now to the sensory innervation. Basically, the main nerve supply of the skin on the plantar aspect of the foot. So all of the nerves that supplies the skin of the plantar aspect of the foot came from the tibial nerve. Next, let's go to the layers of the foot. Basically, it's from inferior to superior, or from the outermost to the innermost. So on the first layer, or the outermost, you have three muscles. On the second layer, you have two muscles. On the third layer, you have three muscles. And on the innermost layer, you have only one muscle. Let's go now to the blood supply of the sole. You have your medial plantar artery and your lateral plantar artery. Next, the nerve supply. So, the main nerves on the plantar aspect of the foot are your medial plantar nerve and your lateral plantar nerve. The muscles innervated by the medial plantar nerve are your abductor hallucis, flexor digitorum brevis, and your flexor hallucis brevis and your first lumbrical. While on lateral plantar nerve, you have your quadratus plantae, abductor digiti minimi, abductor digiti minimi, flexor digiti minimi. You have your adductor hallucis, the second, third lumbricals, and all interossei muscles. Let's go now to the dorsum of the foot. First is your sensory innervation. You have your superficial peroneal nerve, deep peroneal nerve. Basically, these two nerves came from your common peroneal nerve. Your saphenous nerve came from femoral nerve, and your sural nerve came from your tibial nerve. Next, on the muscle. Based on anatomy, according to Snell, the only muscle found in the dorsum of the foot is your extensor digitorum brevis. But if you want to check other anatomy book and kinesiology book, you have your extensor hallucis brevis. Let's go now to the artery. The artery on the dorsum of the foot is mainly your dorsalis pedis, which can be palpated on proximal to the anterior ankle joint. Let's talk about the joints. First, you have your distal tibiofibular joint. Articulation of the tibia and the fibula on the lower end. Let's go now to the ankle joint or your talocrural joint. It's the articulation of the tibia and fibula and the talus. It is a hinge joint. And the ligaments that supports the ankle joint, first is your medial ligament or your deltoid ligament. And your deltoid ligament is the strongest ligament of the ankle joint. And on the lateral side, you have your lateral ligaments. Basically, they are the weakest. Next, your subtalar joint or your talocalcaneal joint. It's the articulation of the talus and the calcaneus. It is a plane type of joint. And the ligaments or the static stabilizers are your medial and lateral talocalcaneal ligament and your interosseous ligament. And your subtalar joint is located on the rear foot or hind foot. Next is your mid-tarsal joint, or also known as your Chapart's joint. So that is your talonavicular articulation of the talus and then the navicular, and your calcaneocuboid articulation of the calcaneus and cuboid bone. And your mid-tarsal joint is located on the medial part of the foot or on midfoot. Next is your cuneo-navicular joint. It is the articulation of the navicular bone and the three cuneiforms. And your cuboido-navicular joint. Articulation of the cuboid and navicular. So take note that the hind foot is your subtalar joint, your midfoot is your mid-tarsal joint, and the rest of the joint, your cuneo-navicular, your cuboido-navicular, your intercuneiform, and your cuneo-cuboid, including your tarso-metatarsal, metatarsophalangeal, and your interphalangeal joint, are located on the forefoot. Your intercuneiform and cuneo-cuboid. intercuneiform articulation of each cuneiform bone. Your cuneo-cuboid is the articulation of the cuneiform and the cuboid. Your tarso-metatarsal joint and your intermetatarsal joint. Your metatarsophalangeal and your interphalangeal joint. Let's go now to the arches of the foot. First is your medial longitudinal arch. So the bones included of the medial longitudinal arch are your calcaneus, talus, navicular, the three cuneiforms, and the first three metatarsals. Its keystone is the talus, and these are its static stabilizers. Next is your lateral longitudinal arch. So the bones included are your calcaneus, cuboid, fourth and fifth metatarsal. Its keystone is cuboid bone. And these are its static stabilizers. And lastly, your transverse arch. So the bone included are your metatarsal bones, the cuboid, and the three cuneiforms. Based on Snell, it has no keystone. But on some books, the keystone is your second cuneiform. And these are its stabilizers.